Let me give a little bit. What I'd like to do is a little bit about the game plan for the rest of the afternoon. We next step is breakout groups in which we'll talk about flexing finances to meet social needs. And all of you have signed up for, or many of you have signed up for groups. Those of you that didn't sign up, we signed up for you. And you're in the rooms around that. Is there a list of who's in up there? Thank you. Um, but in advance, and this is partly a teaser, is I've asked each of the breakout groups to describe what they're going to do, why they're going to do it, and perhaps pitch for your presence. So the first one, Joanne, who should fund professional education?
So Mary Beth and I are going to raise that provocative question of who should fund professional education. No, the question really comes down to how much of financing professional education should be a health system responsibility, the employers, as it were, the educational system responsibility, which might be public sector or might not, or the individual, as in the dentistry model that we just discussed. What is the balance? What are some innovations? What are some different ways of thinking about the problem?
Great, thank you. And the second group will be identifying new sources of money with the new economy to pay for health professional education.
Sure. So our group is going to use as a backdrop the United Nations High Commission report on health, employment, and economic development and try to explore non-traditional new potential investors in health professions education. Who might they be and how can we engage them and what would be a return on investment for new funders?
The third would be Rob Smith, modernizing and his group, including Dr. Chitta. Maximizing government support. Rob, if you could comment briefly.
Yeah, hi. So Wazila and I are going to expand on some things we've talked about. We're going to look at state funding and some of the challenges. It sounds like a great proposition, but there are real challenges and failures that are in there. And we're going to look at the benefits. And then we're going to say, okay, so what is it about targeted funding that might be the answer so we can maximize and deploy it to the things that meet need. And we'll welcome your views on that. And then I think there's a big theme about how we monitor it. So Walter's thing, Wazali's thing about this is where my graduates go was really powerful. Are those the data sets we need to capture to prove this stuff?
Great, thank you. And the final one is the financial justification for socially accountable health professional education. Dr. Kling.
Yes, so we're going to explore in more depth than we did this morning the issues around social accountability. What does it mean? How can we justify it in terms of health professions education with the financial aspect? Look at our educational processes and see if our graduates really are meeting the needs of the society and the population, with special emphasis on certain populations that may be vulnerable, such as the elderly, such as pediatric populations, the poor, and people in geographically dispersed areas. We also want to discuss in more depth what the changes are that we can put in place given the current amount of financing that we have to make both the individual and the population needs of financing more applicable and relevant. And then we want to consider, like many of the other groups are doing, what information do we need to have available to us so that if we're talking about a transparent and accountable system, what do we need to be able to follow and be able to report on to know if we have measurable and improved outcomes. And then finally, as we're filling out our model, what we want to do is to start to identify who the audience is for this model and what audience will we want to direct these comments to bring about effective change, because that's what we're really looking for is change.
Great. Thank you all. So in terms of time frame, if you could be at your rooms by about 3 o'clock sharp, and then 4:30 to go for an hour and a half. Remember, each of the leaders will have what we want, but we're looking in general about how do we flex financing to meet social needs. We're looking at what data do we need to track, how are we going to monitor, who's going to pay for it, and then if you go back and think about our model and its development, how should we adjust our model, and as we describe our model, who should we be talking to and with which information? So 20-minute break and networking, and then meet again at 3 o'clock. Thank you all.